So I'm sure all of us agree that every single one of us, no matter our age, where we live, or how much money we have, deserve an NHS that we can rely on. But years of underinvestment and neglect have left it struggling to cope, and it cannot survive another 5 years of more failed policies. There is going to be a general election at some point this year. It now looks like it will be in the autumn. And this general election really will be a make or break moment for our health service. Is it going to take the road to recovery, or will it spiral further towards irreparable damage? Well, what happens next is up to all of us and how we fight to save our NHS. With millions languishing on waiting lists, deadly delays to urgent care, and burnt out staff leaving in their thousands, the crisis in our NHS could not be more stark. And meanwhile, private healthcare is booming. Record numbers of patients are being forced to pay out of pocket in order to be seen quicker. Private providers are being paid enormous sums to deliver procedures that should be done by the NHS. We're hurtling towards a two-tier health system where our public health service crumbles and only those who can afford to pay receive decent care. Yet none of the major political parties that are vying for power in this election are offering real solutions to tackle this crisis. We urgently need increased investment to match the spending seen in countries like France and Germany, as well as fair pay for NHS staff and an end to the outsourcing of NHS services. We have a plan to challenge politicians across the political spectrum over their inaction, using powerful patient stories which have the potential to go viral, grab media headlines, and maximize political pressure so that we can win a better future for our NHS. But this strategy is only going to work if enough of us step up to make it happen. And if you're going to give time and support to this strategy, we think it's only fair that you all know the plan. So that's why we're having this call tonight and why we're going to be sharing more details about the plan with you. But before we run through the core of the strategy, we're going to hear from the brilliant and fierce NHS defender, Dr. Andrew Meyerson, who is going to share his insights from working as an A&E doctor right now and why this is such a in the fight for the future of our NHS. So over to you, Andrew.
Hey everybody, thanks, Hope. It is a huge honor to join you guys tonight. We are at a really difficult time in the history of the NHS. And 10 years ago, there was news today that NHS satisfaction among patients is at the lowest it has ever been. We're talking 1 in 4 people, only 1 in 4 people have some confidence in the state of the health service right now. And we need to know that that is by design. That was an intentional outcome from 14 years of conservative government, hell-bent on taking what was the #1 ranked healthcare system in the world back in 2010, a time when patient satisfaction was at an all-time high of 70%. 70% of people in this country had faith and confidence in the NHS back in 2010, when patients could see their GP in 24 to 48 hours, when you could go to A&E and you could be seen in under 4 hours, when you could have your cancer care started within 2 weeks, and the waiting list was a fraction of what it is right now. And now after 14 years of this government, patient satisfaction is at an all-time low of 24% now, and we're seeing record numbers being pushed of people being pushed into private healthcare, and that's how this works. They manufactured consent for massive reform in the NHS, with the 2011, 2012 healthcare reforms that all medical professionals, all of the Royal Colleges, everybody that is involved in the NHS said this is a terrible idea. It's gonna be a massive waste of money. It's going to make even fighting a pandemic more difficult. But they didn't listen. And then they didn't listen again when the junior doctors went on strike in the mid 2010s. They didn't listen to the grievances of the nurses, of other allied health professionals, and every year the state of the NHS gets worse and worse and worse. And we see a winter crisis after winter crisis getting worse and turning into winter crisis that becomes, a crisis all year long. And so the state of the NHS is pretty awful right now. And that is because of an intentional policy to underfund the NHS by between 300 and 400 billion pounds. That's effectively this government over the last 14 years has said, you know what, we're just not going to fund the NHS for just 2 years. Sorry, that means something in your country different. Just 2 years. So for effectively over the last decade, they have denied NHS funding for about 2 years of two annual budgets worth of funding, and we're seeing the catastrophic consequences of that right now, with the longest waiting list in NHS history, pushing 8 million people, and deep discontent among the NHS workforce and among patients. Everybody's furious with the state of the NHS right now, and they have every right to be. Um, and that is why we had to go on strike. That is why our nurses had to go on strike. That's why our allied health professionals had to go on strike, because after so many years of trying to raise these issues through the correct channels, this government just doesn't listen, because they are hell bent on undermining this health system, because they only want to see an American style system, that the kind that I grew up with, where it is a two-tier system, where they do not believe that healthcare is a human right. They believe that the best way to deliver healthcare is basically cut out 25% of the people who need it, and that leads to awful health inequalities. And that's not the way that we want to go. That's not the way we need to go. It's not good for the economy. And so that's why we're seeing record numbers of people out of work. The Daily Mail is calling this a Generation Sick note, blaming people for this. After what this government's done, and after the terrible management during the pandemic as well. So there's deep discontent among the NHS workforce. We're seeing waiting lists rise. We're seeing more difficulty in our A&E departments. More A&E departments are adopting body cameras because we're seeing increased assaults. I was just punched by a patient just last week. And these things happen. It's just part of the job, and unfortunately, right now. And so that is why this election is just so important, because it's crystal clear to me that if they get another term in power, then they will turn this system into a fully two-tier system, just like in the United States, where they will cut so many people out of healthcare. They will start charges for all sorts of things, and it's not something I can stand for. It's not something that any of us can stand for. And that's why we're all here together, and that's why I remain actually optimistic about this, because this is a fight that requires NHS staff to stand up, that requires patients to stand up, patients' families who have been harmed to stand up, because all of us are going to need healthcare at some point in our lives. All of us are going to need care at some point in our lives. And unless we fight for it right now, the people that are in charge are going to take it away from us. And that's not okay. And so that's why fighting against these policies from this government in this election is just so important. I firmly believe that this government is a threat to public health, and that if people care about the future of their families, if they care about the health and welfare of their children, then they will not vote for them ever again. The Tory party and the Conservatives have hundreds of years of history with their party, and I think after the last 14 years of this unprecedented assault on public health, that they do not deserve to look after the NHS any longer, and they deserve to be retired. I think that their ideology and what they have done to this country is criminal grade neglect, and they deserve to be retired. And so that's what I hope from voters for voters to, for NHS staff and NHS patients to take a very good look at the candidates that are running in your area. Don't just give a vote to Labour if they don't deserve it. They have a good record on the NHS. They absolutely do. 14 years ago, they'd gotten the NHS to the point where 70% of us were confident in the management of the health system. But they have a penchant for privatization. They don't seem to be learning any lessons from austerity 1.0, and they also are responsible for the PFI debacle. And so we have to keep the pressure on, no matter who is in charge. And we have to think about, what kind of future do you want for your kids? What kind of future do you want for your family? Do you want an NHS that's going to be there for you when you need it, with a proper doctor, proper healthcare, fully trained health professionals, and not undertrained, PAs, many of whom I work with, but we need properly trained people, and especially our GPs as well. So that's why I'm so proud to be here today. I've always loved working with Just Treatment. I have my special T-shirt that I love from Just Treatment. I hope everybody gets one. Yeah, this is a fight that we are going to win, and I'm optimistic that we are going to win it. And that's how but we have to work together with NHS staff, with NHS patients, and just keep amplifying, the bad news that comes out. Keep sharing that to show the public this is what happens when these people run your NHS, and we are choosing differently in this election to take better care of our families, and to build a better future for our children, and for our families, and for our communities. So let's keep up the fight.
Thanks so much, Andrew. It's always so good to hear you speak. You're so powerful, and it's just brilliant to hear your take on the attacks on the NHS, and just really, really important to hear it. And thanks so much for all that you do as well, both for NHS patients and to save our NHS. So everything that Andrew has spoken about tonight highlights why right now is such a critical moment to take action and win change for our NHS. But of course, forcing politicians to back policies which can transform our NHS may seem like a very big ask, especially